This barium study is being done on an 11-year-old boy who persistently has got history of vomiting. This is the swallowing which we are screening now, and it is perfectly normal. The boy is now 11-year-old and weighing around 24 kgs. Expected weight is around 32 to 34 kgs, and his height is also normal for his age, except that the expected height and the observed height has a difference of 4 to 5 centimeters. The complaints are that the boy has got vomiting since the age of 6 months, and these vomitings they last for 5 to 6 days, sometimes to few months, and it is projectile in nature and associated with epigastric pain, and then it subsides. Sometimes they have to take the boy to the local practitioner and he gives some intravenous fluids, and he also has been investigated for with the gastroenterologist. He has done the upper GI endoscopy, which was reported as normal. Now, as you can see here, this is the lie of the stomach, and this is perfectly fine. In the other investigations, that is the CT scan which was done in the recent past, was suggestive of some inflammation in the terminal ileum, for which laparoscopic appendicectomy, diagnostic laparoscopy was done. Appendix was inflamed and hence it was removed, but the vomiting persisted. Colonoscopy reveals that there are some apothous ulcers in the transverse colon. Biopsy has been taken. The reports are awaited. The terminal ileum seems to be perfectly normal on colonoscopy. Now, this is the swallowing which is being evaluated, and it is perfectly normal. As you can see, the dye is entering into the esophagus and going into the stomach via gastroesophageal junction. The lie of the gastroesophageal junction is perfectly normal. This is the lateral position in which we are trying to see the abnormal lie of the stomach. Now, I have made this child supine, prone, lateral, right lateral, left lateral. In all the positions, the lie of the stomach was perfectly normal. In none of the times I could demonstrate that there is a gastric volvulus. The gastric volvulus was suspected because the child has persistent vomiting. It is projectile associated with epigastric pain, and whatever he consumes, he vomits out, and it is a non-bilious vomiting. Here you can see the stomach is perfectly normal, and the duodenum is also normal, and the dye is perfectly entering into the duodenum and going into the proximal jejunum. You can very well appreciate the peristaltic movements, and the dye has now entered into the proximal jejunum. The screening was done intermittently. Here you can perfectly see the lie of the stomach. Both gastroesophageal junction and the gastroduodenal junction, both were seen. They were wide apart. They are not lying close to each other. So there is no evidence of any form of volvulus, or either organoaxial or mesentericoaxial, and not even any slightest doubt of sliding hernia. As you can see, the dye has gone completely into the proximal jejunum. The scanning was done intermittent, and the study is now perfectly normal. His LFTs, KFTs, amylase, lipase, other blood investigations are absolutely fine. Now the central cause of vomiting needs to be evaluated. Thank you.